Welcome, everyone. It's 7:15, so we'll get started. My name is Karine Paré. I'm the marketing director here at Victoria Park Medi-Spa. Very nice of you guys to join. Thank you so much for joining. We're very excited to be able to provide this information to our potentially future clients. I would just like to introduce Dr. Karen Buzaglo before we get started. Dr. Buzaglo is a McGill-trained OBGYN. She joined the Victoria Park Medi-Spa family as Director of Sexual Wellness recently, allowing us to expand our options for sexual wellness for women in Canada. I would just like to say that this is an anonymous webinar, and so as such, your names and videos are deactivated. If you have any questions throughout the presentation, that is great. We definitely encourage some dialogue. You will see at the bottom of your screen that you have a Q&A section, and you can simply click on that and pose your questions that way, and Dr. Buzaglo will address them at the end of the presentation. When you do so, there is an option to remain anonymous to Dr. Buzaglo, and you're also welcome to do that. If you do not check that off, she gets to see your name and your question, but nobody else does. So that is up to you. So without further ado, I am introducing Dr. Karen Buzaglo.
Good evening. Thank you, Karine, for the introduction. I'm very happy to be here this evening with you. So tonight, I will be talking with you about trends in gynecology related to sexual wellness. And I will be sharing information about some of the traditional treatments that we have for sexual wellness, as well as exciting new options that we offer here at Victoria Park Medi-Spa. And also why I chose to do these procedures and supervise them at Victoria Park. So a little bit about my background. So I did my medical school and residency training at McGill University. And then I went on to do fellowship training in reproductive endocrinology and infertility at University of Montreal. And in my 10 years of experience as a gynecologist here in Montreal, I've been fortunate to have thousands of women talk to me about their most intimate sexual concerns. And it has been really an honor and very humbling for me to have these discussions with them. And I realized that all I ever really learned about sex as a gynecologist, and all I really needed to know for my Royal College exam of OBGYN and for my reproductive endocrinology and fertility exam, are the 4 stages of sexual arousal by Masters and Johnson, namely excitement, plateau, orgasm, and resolution. And I thought to myself, wow, as a gynecologist, I should probably know a little bit more about sex. I mean, truly, as a woman and as a wife and mother of 4 children, I could relate to some of the issues that my patients are talking to me about. But really, I wanted to seek more in-depth training and knowledge to be able to offer my patients the best in sexual wellness treatments. So I became an active member of the International Society of the Study of Women's Sexual Health. And that is not about necessarily contraception and STIs, it's really about sexual wellness and sexual satisfaction. And I also went to the UK in London to get training by the European Society of Aesthetic Gynecology. Not so much for the aesthetics part, but really for the functional part of options for sexual health and sexual wellness for women. And so I gained a lot of experience in offering laser treatments to women and PRP injections that I'll talk to you about. And I really truly believe in this technology as life-changing for women who suffer from issues that really, at this point in 2021, we really shouldn't be suffering because there's so many different options out there, and I want to share them with you. So first, we'll talk about the trends in gynecology today. First, that there's an increased awareness of sexual wellness issues. Millions of women suffer from long-term effects of pregnancy and childbirth, including vaginal laxity, incontinence, pelvic organ prolapse, and from really normal postmenopausal vulvovaginal atrophy. And there has been over the last few decades an increased life expectancy thanks to medical advances. And 40% of a woman's lifetime is spent in the postmenopausal years. That's a lot of time. The prevalence of female sexual dysfunction, well, in premenopausal women, overall, about 40% of women suffer from some type of sexual dysfunction. In the postmenopausal years, 64% suffer from hypoactive sexual desire disorder, 31% from hypoactive sexual arousal disorder, and 35% from functional orgasmic disorder. And a lot of women hide these symptoms from their partner. 90% of postmenopausal women report that an active sex life is very important to them, but very few women really consult a physician about sex in their lifetime. And the consequences are huge on women's quality of life, their self-esteem, their interpersonal relationships. So all this is very, very important. Another trend in gynecology is that there are medical and non-invasive treatments that are the new normal to assist in women's gynecological health. So about 30 years ago, any woman with a gynecological problem would get a hysterectomy, for example, and we would lean towards surgical treatments. And now we have a whole plethora of options, medical and non-invasive, for women to treat common medical gynecological concerns. Another trend is our generation is less secretive, especially for those under 40. There are fewer taboos, fewer secrets. People post their whole life on social media, Instagram, Facebook, etc. They share their life story. So women are talking to women about their most intimate issues, and this is a very good thing. Another trend is what we call the new sexual revolution. So two sexual revolutions. The first was in the 1960s with the women's movement, and you could think of the birth control pill and abortion rights. And back then it was becoming okay for women to want to have sex for sex and not just for procreation. And today we're talking about the new sexual revolution. Women want to have better sex, and we're educating young women. As you can see, this was a study published just in December 2020, in a bid to shield high school age women from poor coercive relationships. A new mode of teaching prioritizes safety, assertiveness, and desire. And a book that was published, The Pleasure Gap, also in 2020, American Women and the Unfinished Sexual Revolution. But yet, still in 2020, the focus on women's solutions remains unequal. These are the drugs approved for men for sexual wellness, and the drugs approved for women in the US for sexual wellness. And you can see the huge disparity between men and women still. Drugs approved for women, as you can see, this one over here, flibanserin. The first one is the only one that's recently been approved here in Canada for premenopausal women with hypoactive sexual desire disorder, so for lower libido. And so this is also very, very new to Canada. Another very important thing is, as a reproductive endocrinologist, I focus a lot on hormones and on the hormonal changes that impact sexual functions. Hormones matter, whether it's hormonal contraception, some fertility treatments, being pregnant, postpartum, breastfeeding. These all have an impact on sexual function and sexual health. Certainly women who have their ovaries removed, both ovaries removed, go into surgical menopause from one day to the next. And certainly cancer treatments, specifically for breast cancer, certain hormones that we give to women long-term can have an impact on sexual function. And yet, physiologically, every woman's going to go through menopause, and this is very normal. So at one point, the short-term symptoms of menopause that include hot flashes and night sweats, those eventually tend to go away. But long-term, you could see over here, the urogenital symptoms are a long-term problem for women going through menopause and late menopause, such that 88% of women in the late menopause have some form of sexual dysfunction related to vulvovaginal atrophy. So just some of the traditional options that we offer women for sexual concerns, certainly hormone replacement therapy. So we prescribe now bioidentical hormones that are very safe and effective for the menopausal transition period. So for perimenopause, back in 2002, there was a study that scared everybody off hormone therapy, but now we're very comfortable in prescribing these therapies, including local estrogen for vulvovaginal health. Certainly over-the-counter products like vaginal moisturizers, lubricants, hyaluronic acid that is available now to help with vaginal dryness. Pelvic floor physiotherapy. So for stress urinary incontinence, we tell women to do their Kegels and send them to pelvic floor physiotherapists for bladder retraining. Some of the surgical options, again, for urinary stress incontinence, slings, for example, the TVT, TVTO, TOT procedures. These have been problematic because, in fact, there have been class action lawsuits in the US, and the Collège des Médecins got involved here in Quebec because these sling procedures were causing a lot of problems. The mesh procedures were causing long-term pain, damage, scarring for women. And so there has been a moratorium on doing these procedures. So we're left with looking for non-surgical approaches to treat incontinence, including physiotherapy and some of the treatments I will discuss. Periurethral bulking agents, this is relatively new here in Quebec as an option for incontinence. Vaginal pessaries that we offer women with pelvic organ prolapse. Certainly these are mostly used for women who are not sexually active or not very sexually active later on in the years, if their organs have really descended down to the introitus or the beginning part of the vulva. Vaginal dilators that we offer women who have tightness in the vagina and have difficulty with penetration. And certainly lifestyle modifications that are very important. A healthy diet, being active, exercising, lowering alcohol intake, all these things will improve sexual function. And definitely sex therapy that we often refer women to for the biopsychosocial aspect of it all, and that's hugely important. So all of these things are important, and they are all used like in multimodal ways, multidisciplinary ways to help women with sexual function. So now I will be sharing with you 4 treatments that are offered at Victoria Park. First the DIVA, then the EMSELLA, the O-shot, and the G-spot amplification treatments. So first of all, the DIVA. The DIVA is revolutionary. It is the only laser, the world's first and only hybrid fractional laser therapy technology to restore vaginal tissue and improve vaginal health. What it does is it delivers 2 laser therapies at once for a combined synergistic effect. So it's essentially a probe that goes inside the vagina and emits a laser 360 degrees. And the first laser helps with the resurfacing of the vaginal wall, replacing it with new and healthy tissue. And the second laser goes deeper, heats the deeper layers or the lamina propria, stimulating regrowth of new collagen, blood vessels, and nerve endings. And so it utilizes hybrid technology, and it delivers those 2 therapies. It improves vaginal laxity, so loss of elasticity and tone from childbirth. It helps with overactive bladder, stress urinary incontinence, so that's incontinence, leaking urine when coughing, laughing, sneezing, jumping. It helps with vaginal dryness, painful penetration at intercourse, and genitourinary syndrome of menopause. And in fact, I just had a patient today that came back to see me after 1 year from doing her DIVA treatments. And she reports that she has had 0 urinary tract infections and doesn't wake up at night anymore since doing the DIVA. So really we're seeing much improved vaginal health from laxity, from dryness, depending on the different issues. And really in a woman's life, there are 2 major life events that really will change vaginal tissue. And first is childbirth, just the stretching and the injury to the pelvic floor from childbirth. And the second is menopause and vulvovaginal atrophy from menopause. And we could see here histologically, looking at these slides before treatment and 3 months after the 3 treatments, we see here more glycogen-filled epithelium, increased blood vessels, and collagen in the lamina propria. And so we do see histologically quite an improvement. So the DIVA laser is a very efficient treatment. It's 3 treatments that are about 5 minutes, scheduled 4 to 6 weeks apart. It is very safe. There have been 0 adverse events from this technology. It's very comfortable. Women report 0 to 3 out of 10 for pain. There is numbing cream that we can give if there is pain before the treatment. It's very hygienic. It's the only laser technology with a disposable handpiece for one-time use. Satisfaction rate 90 to 100%, depending on what the patient is coming in for. And there's an optional aesthetic treatment, the DIVA Tight, that helps with the vulva, and that's done with technicians here at Victoria Park. Second revolutionary procedure is a BTL EMSELLA. And so BTL EMSELLA works on the principle of a patented HIFIM technology. So that's high intensity focused electromagnetic technology. And essentially it helps reach super maximal muscle contractions of the pelvic floor, very similar to the M-Sculpt that you may have heard of, all while sitting comfortably on the EMSELLA chair. So really sitting 90 degrees on a chair, fully closed, to have these super maximal contractions of the pelvic floor. And this is used to treat urinary incontinence. So just to go over urinary incontinence in more detail, urinary incontinence is involuntary leakage of urine that represents one of the most concerning female intimate health problems. Postpartum and postmenopausal women, again, represent the largest patient population that suffer from this. Half of the women don't necessarily seek help about this. And there's 3 types of incontinence. The first is stress incontinence, as I mentioned, leaking when coughing, laughing, sneezing, jumping, etc. The second is urge incontinence. So that involves an involuntary loss of urine when a person has a strong sudden need to urinate. When you gotta go, you gotta go. And the other one is mixed incontinence, which is a combination of both stress and urge incontinence. And so to get back to the BTL EMSELLA, it uses HIFIM technology to cause deep pelvic floor muscle stimulation. And the key effectiveness is based on this focused electromagnetic energy and in-depth penetration and stimulation of the entire pelvic floor area. And a single session brings thousands of supramaximal pelvic floor muscle contractions that are extremely important in muscle re-education. And so if you compare Kegel exercises, the common Kegel exercises that we tell women to do versus the BTL EMSELLA delivers the equivalent of 12,000 Kegel exercises in 28 minutes. So how many years of Kegel exercises should a woman do to achieve that result? Or how many sessions of pelvic floor physiotherapy? A lot. So this technology is, again, very efficient. So there's 6 treatments scheduled twice a week over 3 weeks. The results show a durability at 6 months. 95% of treated patients have improved their quality of life from doing these treatments. And the right candidate are those with stress, urge, or mixed urinary incontinence. Now, of course, it's very important to realize that not all women are candidates for these therapies, neither DIVA nor EMSELLA. I choose my patients very carefully because certainly if a woman has, incontinence all throughout the day, needs to wear a diaper, or has pelvic organ prolapse, the uterus coming through the vagina, certainly they're getting a consultation with my urogynecology colleagues. But most women will benefit greatly from both DIVA and EMSELLA for mild incontinence and certainly for some pelvic organ prolapse, dryness, laxity, all of these different things. So now we're going to talk about sex. This is a fun topic because these are really new options for women, sexual wellness and satisfaction. Say yes to better orgasms. Who doesn't want that? So I wanted to share with you a definition of what an orgasm is. this definition I thought was great and is quoted in most textbooks now, and certainly at the International Society of Women's Sexual Wellness. This is a Canadian psychologist who does a lot of work in neuropsychology of women's sexual health. And so she defines an orgasm as a variable transient peak sensation of intense pleasure, creating an altered state of consciousness, usually with an initiation accompanied by involuntary rhythmic contractions of the pelvic striated musculature, and often with concomitant vaginal, uterine, and anal contractions and myotonia that resolves the sexually induced vasocongestion, generally with an induction of well-being and contentment. And there's different types of orgasms. So there's the clitoral orgasm, which is rhythmic contractions of the vagina activated by clitoral stimulation. Vaginal orgasms, rhythmic contractions of the vagina activated by the anterior vaginal wall and periurethral female tissue stimulation. Cervical and uterine orgasm, displacing the cervix, causing it to rub against the peritoneal lining, inducing pleasure accompanied by apnea and gasping. And certainly blended orgasms, which are a combination of the above, and certainly possible from stimulation of other erogenous zones. So what is the O shot? So first of all, I want to show you this image of the clitoris, which embryologically, if you didn't know, is equivalent to a male penis. So the glans clitoris is equivalent to the glans of the penis, and the crus clitoris is equivalent to the shaft of the penis. So all this is very, very sensitive tissue, and it's not just the tip that you see on the outside of the vulva that is sensitive. It's a whole organ. And so the idea of the O shot is to inject platelet-rich plasma into the glans and crus clitoris under local anesthesia. And PRP is used more and more now for hair growth, for joint pain, so musculoskeletal system, for the face, the skin rejuvenation, etc., and can also be used to stimulate the clitoris in the O shot. So this is an office-based non-surgical procedure that promotes blood flow and neuronal regrowth. So essentially what we do is a blood draw, and then centrifuge the blood and separate the platelet-rich plasma from the rest of the blood. And this platelet-rich plasma is injected after numbing local anesthesia cream directly into the clitoris and the surrounding tissues for dramatic enhancement of sexual response. And with this PRP treatment in the clitoris, we find improved arousal from clitoral stimulation, stronger orgasms, more frequent orgasms, and this typically lasts 18 to 36 months, typically a year. It's a very quick procedure. You're in the office for about 30 minutes, and the actual injection takes about 8 seconds, and you can resume sexual activity after 4 hours. The second is a famous G-spot amplification, or G-shot. And the G-spot, the term was coined by Dr. Grafenberg, a German gynecologist, in 1950. It's a highly erogenous area. It is located in the anterior wall of the vagina, inferior to the urethra, midway between the pelvic bone and the cervix. And it's believed to be responsible for vaginally mediated orgasms. And its existence has been controversial for years. Even gynecologists don't all believe that it exists, but we know it exists. And there are ways to help improve sexual function from G-spot orgasms. So essentially, this is a procedure that uses hyaluronic acid that's injected into the G-spot to make it more prominent, so that your partner could better identify it. It helps increase friction, sensitivity, duration, and frequency of vaginal orgasms. This is done with a special patented speculum that's open on the anterior wall of the vagina, an injection into the G-spot after the patient has located where that G-spot is, the most sensitive area, and then an injection of local anesthesia and an injection of hyaluronic acid. Also, the procedure takes about, total maybe 20 minutes, but the injection takes 8 to 10 seconds. And typically it lasts 3 to 6 months. So why did I choose to offer these services at Victoria Park? Really, it's for the 3 brand promises. First is that Victoria Park Medi-Spa is led by physician specialists. And really, I was very attracted to the area of technology here, very avant-garde approach, the latest and the best technologies that are available here at the Medi-Spa. And we have a variety of treatments so that you get the solution or combination of solution that is best for you. And it's obviously very well known for its remarkable surface, and I'm very, very thrilled to have joined the team here. So in this presentation, I hope to have conveyed to you the latest in non-invasive treatments for vaginal laxity, tightness, dryness, incontinence, orgasmic dysfunction. And there is and will continue to be advances in sexual wellness treatment options for women. It's 2021, it's about time. And I hope to help you choose a solution that is best for you after discussion of all the different treatment options. And I hope to help you regain sexual satisfaction and confidence to get back to the real you. Thank you. And we're going to see if you have any questions. This is the phone number to call Victoria Park. If you would like a free consultation, you could book it through this phone number. So I will look up your questions, and I'm going to need Karin's help for this, please. Thank you.
So we'll just stop sharing.
Okay, so I have some anonymous questions I'm very happy to answer. The first one here is for the stress incontinence. Which treatment between the 2 do you recommend? Very good question. And then second part of the question, do you recommend that treatment before having a child? I'm currently in the process of IVF. Okay, so for the stress incontinence, I think it's a bit of both, to be honest. It depends on what you're looking for long-term, but I would say if the focus is really on the incontinence, I think the EMSELLA chair is a wonderful option. If it's also, if the issues are also related to a little bit of prolapse, laxity, depending on where you're at in your reproductive lifespan, we can certainly discuss the DIVA as the other best option or another option for you. Do I recommend the treatment before having a child? Not necessarily, because you may end up with a vaginal birth that could, you may end up needing it more later, but certainly can help you short term. And if you want to revisit it after childbirth, you can do that as well, or wait until postpartum. If you're currently in the process of IVF, certainly understand, some of the sexual difficulties that couples face when going through IVF. Having sex on demand or having sex when your doctor tells you to have sex is not always easy and can certainly cause some issues with intimacy and wanting to have sex for sex. Which brand of hyaluronic acids do you use for the G-spot is another question. Restylane, basically any hyaluronic acid can do, but we have one that's specific that we're using here at Vic Park. What are the price ranges for the O shot and the G shot? So the O shot, I think the best is to call Vic Park to get the exact pricing. I believe the O shot to be about $1,200 and the G spot amplification to be about $1,500, but please call Vic Park to get the prices. Next question, will these services be provided in the Pointe Claire location or are these only available downtown? Thank you for this, thank you. So the DIVA, I believe, is also located at the Pointe Claire location. The EMSELLA is not yet available in Pointe Claire, but is available here in Westmount and in the east end of Montreal.
But it's coming in Pointe Claire.
It's coming in Pointe Claire, as per Karine. Any other questions for now? Yes, there are more questions. I'm just going to scroll down here. Will bioidentical hormones, local estrogen help deal with vaginal dryness? Certainly, yes, local estrogen does help with vaginal dryness as a first-line treatment. Some women don't feel comfortable using hormones, and some women have a contraindication from their oncologist, for example, for cancer patients to use hormone therapy. So we respect that and offer laser instead, or certainly hyaluronic acid or vaginal moisturizers or different things that you can find at the pharmacy. Hi, although I'm enjoying the sex I'm having in terms of arousal, I've never experienced orgasms. Would the O shot be the best option for me? That's a very good question. Again, the selection for these treatments is very individual after discussion. Mostly, definitely for the G-spot, I would say if a woman has never felt a G-spot orgasm or vaginal orgasm, it's probably not indicated. Because it will help enhance the G-spot for those who have felt G-spot orgasms. Now for the O shot, certainly I have seen many women benefit from this. Women who have never had an orgasm have benefited from this. And so definitely I think it's worth a try. Excellent, thank you. Thank you. Is there a minimum recommended age for the O shot? Certainly, I would say not under the age of 18. And I would say after informed consent, depending on the situation. Are you able to practice sports after the 4 treatments? Certainly, yes. You can go back to all your regular activities. Walk out of the Victoria Park Medi Spa and go back to all the activities you're used to doing. And who do you recommend as a sex therapist? I don't know that I want to disclose personal names of therapists. Certainly there are several excellent sex therapists in Montreal, but I will be happy to share some options with you in person. Can you see regular OBGYN? Can I see you as a regular OBGYN as well? Yes, with pleasure. I don't do regular gynecology here at Victoria Park for all things that are, general GYN, pap tests, etc. I work out of Medical, Clinique Medical downtown Montreal. And here we will focus really on sexual wellness. But I'm happy to address any of your sexual wellness concerns here at Vic Park. Tennis. So this is referring back to the sports. Certainly tennis, does not increase necessarily pelvic floor pressure. So I don't see any contraindication to going to play tennis after these treatments. Risks for the O-spot injection. Is it injected by a doctor? Yes, I will inject it as a doctor. Any risks? Certainly it is pretty risk-free. I mean, the only contraindication to the platelet-rich plasma injections are any problems with your platelets, any known problems with your platelets, or taking antiplatelet medication. But really the risk is minimal. It's a simple injection of your own blood plasma directly into a different part of your body. And I think that's it for questions. I will definitely be seeing you soon. Oh, thank you. I'll be happy to meet you. Thank you so much for addressing this issue. I'm very happy to help. How much is the cost for is it the O shot? The O shot, I believe, is $1,200, the G shot, $1,500, but don't quote me on that. Please call Vic Park to get proper pricing. And if we don't have any other questions, I will move on to some testimonials. Thank you. It's a very interesting conference. Thank you so much. I look forward to helping you with any of your sexual health concerns. Thank you, Gaetana. So I will get to share screen. Share screen. I need technical help. Share screen here. Yeah, go ahead. So go on to some testimonials that I'd like to share with you. First is for the EMSELLA. Yeah. And I'll answer any questions afterwards.
J'ai suivi le traitement EMSELLA parce que après avoir eu 4 enfants, j'avais le plancher pelvien un petit peu fatigué. Puis je me réveillais la nuit pour aller à la salle de bain et de nombreuses visites durant la journée. Fait que c'était évident, il fallait que je trouve une solution pour remédier à ça. L'incontinence affecte la journée au quotidien puisque juste penser à ma routine avec les 4 enfants, de partir de la maison, d'aller reconduire les garçons à l'école, c'est évident que j'avais au moins 2 arrêts. La première avant de partir et une arrêt pendant mon trajet. Le traitement, moi, les EMSELLA, je les appelais les 2 pour 1 puisqu'on s'occupait de nous 2 fois plutôt qu'une. Donc, pendant 30 minutes, on était assis sur une chaise qui, elle, s'occupe de nous. Puis moi, j'avais 30 minutes de paix où que mes enfants ne pouvaient pas me déranger et je pouvais lire un livre. La sensation, on ressent comme un picotement. Je ressentais des petites contractions, là, mais rien pour déranger ma lecture. Là. Mes résultats, quoi dire? Je suis tellement satisfaite. Après mon premier traitement, j'ai fait ma première nuit. Ça faisait tellement longtemps que je n'avais pas dormi toute une nuit sans me réveiller pour aller aux toilettes. Là. Donc, j'étais déjà satisfaite. Puis après 6 traitements, maintenant, j'ai une journée typiquement normale. J'ai plus besoin d'aller aux heures à la salle de bain. Il y a eu d'autres bénéfices côté sexuel. En plus, ça a vraiment renforcé tout le plancher pelvien. Vu les résultats, pour moi, c'était le plus bel investissement que j'ai pas pu faire sur mon corps. Après 4 enfants, je pense qu'on mérite ça un peu. Quand je suis rentrée ici, là, chez Médecin Victoria Park, j'ai tellement été bien servie que je n'ai pas senti que j'étais une cliente qui venait juste faire un petit tour. J'ai vraiment senti que je rentrais dans une famille. Donc, c'était évident pour moi que je n'allais pas ailleurs pour d'autres traitements.
Beautiful. Down. Okay, this one is for the, you want this one? This one, there you go. Okay, for the DIVA vaginal rejuvenation treatment testimonial.
I was 45 years old and I was diagnosed with stage 4 breast cancer and I was given less than 2 years to live. So I had 174 chemo treatments, 8 months of chemo pills, radiation therapy, and 5 surgeries. And at the end of 5 grueling years of fighting, miraculously, I went into remission. So in my case, I went into very sudden menopause. So I was 45 years old and very healthy, and then all of a sudden I was in menopause. And I began having very frequent urinary tract infections. Sexual relations were painful and then eventually non-existent. So after I went into remission, I began thinking about how much cancer had stolen from me and how I really needed to work at getting my life back, because I did feel like I'd lost 5 years of my life. I'd lost my self-confidence, I'd lost my femininity, and I'd lost my intimacy with my husband. So that's why for me, it was really important to see what was out there and what I could do in order to get that back, in order to become the person that I was before I got the cancer diagnosis, and in order to show my husband and even to show myself that I was the woman that I used to be, regardless of the fact that I'd had cancer. When I came to Vic Park, automatically I had chemistry with the technician. And she actually said to me, do you feel comfortable with me? Do you think that you will be able to do this with me? Which I thought was really appropriate, because there was a concern not just about what the treatment was going to be like, but how I as an individual was going to feel, because this is something that's very intimate. So I really appreciated that. And then coming into an environment that is beautiful and spotless, and people are treating you with such openness, for me was something that really meant a lot, because I did come here being quite nervous. And so I really appreciated the fact that everybody was so open and understanding. What I really appreciated about the procedure was that the technician explained to me clearly before she even started what to expect And she also explained to me that during the procedure, we could stop if I was beginning to feel uncomfortable. So I really did feel as though I was in control from the very beginning, which is important. The procedure itself was very quick. It was not painful at all. And I think also the fact that I knew that at the end of this, something very positive was going to occur helped make the procedure that much easier for me. I feel wonderful. I feel like the woman I was before I even heard that I had cancer. I'll be honest with you, I feel sexual. And that has brought my husband and I together to a point that we thought we would never have again. So the romance is back. He's comfortable. I'm comfortable. There's no more concern about pain. And it's just had such an incredible impact on a relationship that was already great, but it's brought the relationship back to what it was before I had the cancer diagnosis.
Okay, I'm going to see if there's any more questions. Escape. And then stop. Share. Okay, Q&A. What is the price range for the EMSELLA? I believe that it's a 6-package treatment for $15.90 is what I'm told is the pricing for the EMSELLA. Please call Vic Park for further information. Okay, so thank you for joining us this evening, and I look forward to meeting you in person. Have a good evening.